So for our last lesson in the Patient Encounters series, we're going to do a quick lesson just on the physical examination and some of the specific components to working within a physician's office. So highlighting some of the basics from the normal physical in a physician's office and also how we can use those in a variety of settings, because in reality, the athletic trainer is a healthcare provider. And in fact, understanding how the healthcare procedure works in a normal office visit is important, so that way we can carry that over to our athletic training rooms. In addition, there are a significant number of jobs available working out of physician offices, specifically in the orthopedic clinics. Also, there are concussion clinics popping up, all sorts of different areas where athletic trainers are taking the roles that have traditionally been done by either nurses or medical assistants, because they have a unique set of skills that will allow for the physician to be more efficient and thereby provide better care to their patients and make more money for their clinic. And so you can see here as an example where you can see from the number of patients that can be seen with an athletic trainer compared to a medical assistant being within the physician's office and helping do some of those duties that we're going to talk about here. And since you can see, if they can see more patients and be more effective at providing care, they can end up putting some of that money into the salaries of the athletic trainers. And so one of the highest paid areas within athletic training is the physician practice group. A lot of options are available in that area where athletic trainers do these procedures that we're going to be talking about here within the physician's office, and help the physician see more patients, be more productive. And specifically in orthopedics, right, where you're working with an orthopedic surgeon who makes most of their money in surgery. If you can do more surgeries because you can do more follow-up visits in the same amount of time, that can make a lot of money for everyone involved. Plus, the added benefit, right, is that is true in the medical model from the standpoint of a very scheduled, routine-based practice. And so a lot of opportunities for individuals to work as athletic trainers in physician offices and make good money while also not having to deal with as much crazy scheduling. So we'll look at some of the skills that would be needed within that as far as just some of the procedures. First and foremost is preparing the examination room. Nothing particularly enlightening here. I mean, some of the normal things, cleaning and checking for supplies, cleaning, disinfecting the examination tables, countertops, and faucets daily. You know, some of the housekeeping things we talked about. Privacy should be important throughout healthcare, but is particularly important within the physician office. So it's important to remember to keep the exam room door closed during all patient visits. Also making sure that all of the equipment is operable and ready and is in a area and according to the provider's preference can help create that easy, efficient system that is so important. So the first thing in healthcare that's important for athletic trainers to understand, not only for physician practice, but for all of healthcare, is the importance of patient identification and this procedure that's sometimes referred to as rooming a patient. So after greeting and escorting all patients, it's important that you ask them to identify themselves by name and date of birth. You ask them to identify themselves opposed to asking, are you John Doe? And the reason for this is because if a patient may not hear you and they still might just try to be understanding or helpful, and they just answer yes, but you have the wrong patient, and you can be, if you do the wrong procedure on the wrong patient, obviously that's not good for anybody, but you are specifically liable for that. So when you room a patient, you bring them back, you should ask them to identify themselves by name and date of birth and compare that then to the patient's demographics and the patient's chart. Once you get into the room, the standard process for that is obviously you do hand hygiene at the beginning before every treatment. You're going to take baseline vital signs, height, and weight, and explain the purpose of the examination, offer to answer any questions, or get an initial history within there. Whatever the role is, whether or not it's a follow-up visit or it is an initial visit with there. And then one of the big things an athletic trainer can do specifically is help decrease the apprehension by providing a familiar face, as well as decreasing some of that anxiety associated with the physician by giving some more detailed explanations. It gives some examples of how you can do that overall, but athletic trainers as a whole are pretty good at that portion. After you've completed that initial examination, you need to document it, right? There's still the paper records, but more commonly in the physician's office, you have these electronic medical records with different aspects, and this is just a template that pulled through, but a lot of these are just pull down type measures, as far as click. This one here is out of a hospital. Looks like because it has different times for follow-ups with there. It could just be whatever you're going through, a lot of clicking and all that. And you've been in the physician's office before when the nurse or medical assistant is doing that. They're checking medications, all that sort of stuff within the EMR system directly that allows for the provider to do their notes associated with that and have that information already completed. Another important aspect for all of healthcare, and specifically in the physician office, but also should be more important in the athletic training room as well, is the concept of modesty. Oftentimes you may have to ask a patient to change, and that's a fairly uncomfortable situation. So giving them as much information as possible as far as exactly what clothing needs to be removed, if they need to wear a gown, how to put on the gown and the location of the gown opening with that. Any assistance that needs to be provided as well, but trying to keep them comfortable and private. On that same note is the idea of positioning and draping, right? And trying to put people in a position of comfort, but also a position of modesty. And with draping, this has the added goal of comfort and warmth on top of modesty. The important with positioning and draping, and we'll look at specifics on how to do that within the lab, but basically you're using either toweling or that paper cloths and draped aspects with there, and you're just going to expose the region of skin that is necessary for the exam or the treatment to be conducted. The important aspect with this is to do as you see here. Take the toweling or drape and tuck it into the clothing and then pull back. You never want to push because you can slip and go underneath the clothes. In this situation here, right, you will always have a barrier between you and the patient in the draping. You could do the same thing on the lower half with their pants as well and pull that down. So that way all you're seeing is exposed skin. So I put after this one, another drape across here. You can also drape to the sides and just expose one area. After you're done, right, and you're leaving the room, You need to make sure that the patient's medical record is available for review by the provider. There's usually a designated area, or make sure you log out of the computer with that. That's an important aspect throughout, right, with our medical privacy. And then as you leave, hand hygiene, both entering and exiting rooms. Cleaning the examination room, you remove the paper, apply gloves, and then clean and disinfect the table. Once it's dry, unroll a fresh length of paper across the table there. Discard any disposable supplies, check equipment, as well as remove reusable equipment so that it can be properly sterilized as needed. So again, if you have any questions, please let me know. Otherwise, have a great day.